11 a.m. here in Seoul, I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation available for you in English. Vice Health Minister Kim Gang-nip will be briefing us on the coronavirus situation here in South Korea, filling us in on the number of new infection cases seen as of midnight and what kinds of efforts the government is making to contain the virus. He's taken to the podium now, and it looks like the briefing is just about to begin.
We also have sign language translation available. First of all, here is Mr. Kim Gang-nip on the briefing. Let us now begin our regular briefing for August 12th, Wednesday. As of today midnight, we have a total of 35 new local infections and 19 new imported cases. The total number of confirmed cases now stands at 14,714, and 623 people still remain in quarantine undergoing treatment. We had no additional fatality, and the death toll now stands at 305. This morning, the KCC held a meeting presided over by Prime Minister Chung Se-kyun, and we discussed many issues regarding the quarantine aspects. And Prime Minister Chung has stressed that in the cabinet meeting yesterday, we had the revision of the Act on the Infectious Disease as well as the Government Restructuring Act, and he says that we will exert our full efforts to this end. And he also expressed concerns on the Korean Medical Associations with scheduled walkout for the 14th, which is Friday, and he asked the association to engage in candid dialogue with the government. Lately, we have seen small cluster infections centering around the religious centers here in the metropolitan area, which is spreading to the traditional market, and we are also seeing cluster infections in Busan centering around a high school as well as the vessels and a port. And the government, based on our experience and know-how, we are currently exerting our full efforts to contain the virus. However, we always ask the public to stay vigilant and to maintain their quarantine measures. In particular, in the Gyeonggi-do province as well as the metropolitan area and Busan, we ask the members of the public to refrain from going to crowded places and enclosed spaces, and always wear face mask when you go to an indoor space. As well as at funerals and the wedding halls, we have some of the quarantine measures we have been putting in place. These funerals as well as wedding halls are places where a lot of people gather and they share meals, and we have our special targeted quarantine protocols. And in preparation for the upcoming Chuseok holiday, as well as an increase in the number of weddings, we are exerting our full efforts to contain the further spread of the virus at these specific places. And as for the funerals, we will be asking the managers to streamline the providing of foods, and we will also have a mandatory information session to brief these protocols for the managers. And at the entrance, we will also have a responsible manager who will be looking into the screening of the body temperatures of all of the entrants, and also have a QR code and the thermal cameras installed at these places. The government will also continuously to monitor the situation going forward. And at the wedding halls, we will exert our special efforts for the buffets as well as the entry logs. First of all of the buffets that are inside the wedding halls will be designated as high-risk facilities. And starting from the 6 p.m. of the 19th of August, we will be mandating all of the entrants to wear face masks, as well as at the buffet restaurants. Starting from June, these places have been designated as high-risk facilities. However, the buffets within the wedding halls were not under these specific measures. And as for the wedding halls, we will also mandate the QR codes as well, and we will also mull over the system of having the introduction of an online money wiring system for these wedding halls as well. Moreover, we will look into these situations at the restaurants which are prone to high infections, and we are going to take special monitoring into whether all of the people are wearing face masks and whether they have the individual plates and individual objects. And we have designated 4,362 relief restaurants nationwide, and we will going to further to monitor the situations going forward and pick these model restaurants as well. And as for the increasing of the capacity of medical schools, we have some words for the public. We have been advising such measures, and we announced such latest measure, and we believe that we cannot delay this aspect even longer, considering the high discrepancy of the imbalance of the medical services. And in the Gangwon-do province, at the 18 cities, in most of these provinces and cities, there are less than one medical doctor at these cities, and many of the hospitals there do not have an ER, and therefore many people need to go to other regions to get medical services. This is very different from the metropolitan area, especially in Seoul, and we need to also prepare ourselves for chronic illnesses as well and infectious diseases. And in the next decade, 1 out of every 4 people will be our senior citizens, which means that we will have an increase in the number of demand for medical services. And we need to seriously concerned be and mull over the fact whether the current status will be sufficient in taking care of the medical services going forward. And by every one doctor here in South Korea has to look at more than 3 times the number of patients compared to the average of OECD countries. And while the regional provinces have seen a lack of the number of doctors, however, many doctors here in the metropolitan area have a very intensified workload as well, and therefore we need to strike a balance between these two regions, and we believe that this is the first step in addressing this imbalance and discrepancy. And so far we have had a lot of discussions with the medical experts, and we have seen an increase of the opinions of the need to address such issue, and the government also believes that we shall address this measure with a specific action instead of just words, and therefore we aim to take this opportunity to as an opportunity to take an upgrade in our medical systems. And of course we believe that increasing the capacity of medical schools right now will not permanently ease such issues. However, many more efforts on a multifaceted efforts will be needed going forward. The government will also focus on dispatching the doctors at regions, especially at specific divisions that are needed. And we will also review the revision of the incentives given to these regional doctors. And we will also provide systematic and financial support to nurture more doctors going forward. And first, with the number of increasing the capacity of medical schools, we will need at least 6 years to nurture more medical talents. And taking this consideration, we will consult continuously with the medical circles as well. And please remember that the government is opening our ears to the opinions of the medical circles. We are listening to the opinions of the medical experts, whether they be doctors or nurses. And rather than increasing the capacity of medical schools, there are also opinions on the need to have a balance between the regional doctors. And there are also many other opinions as well. And we believe that we need to have a very robust policy at the principal. And there are also opinions of the need to increase the number of nurses as well as an increase in the number of trainee doctors as well. So these diverse opinions will also be listened and reflected, and we believe that they are also aimed at the common goal of increasing our medical services quality while alleviating the imbalance of the medical services by region. And the Korean Medical Association has requested on the 1st of August, they have delivered us 5 suggestions, which included the need to establish a consultative body between the association and the government. And to this end, the government has established a comprehensive scheme to take this into consideration, and the government has also reflected and suggested this to the association. And we also request the association to step out to the negotiation table so that we can begin the first round of negotiations starting from this week. And we will also have subdivision meetings, and we will also discuss matters on the number of incentives and for the regional doctors, and also the detailed measures to nurture high-quality trainee doctors at different provinces. And the government will exert its full efforts to have these messages be heard, and we ask the Korean Medical Association to also reconsider this as well. There are many patients who are going under immense physical pain, and we ask you to refrain from such group activities which can put at risk the citizens' safety and health. And we ask you to work with us to alleviate any concerns. Thank you very much.
That was our Vice Health Minister Kim Kang-rip briefing us on the coronavirus situation here in the country. He just told us that there were 54 additional cases of COVID-19 in South Korea, bringing the accumulated total as of midnight to 14,714. There were no additional deaths, however, meaning that the death toll stands at 305. That wraps up our coverage of this morning's briefing. We'll be back with our regular newscast at noon Korea time. Bye for now.